Thank you, Mr. Speaker. I rise in support of this amendment that seeks to strike Section 5 from the bill. Clearly, we need to keep our roads safe and make them even safer if we can, and I applaud the Committee on Transportation, the Chairman, and the Speaker for bringing this bill forward. It contains many important components around the area of texting while driving. We've just enacted an amendment requiring hands-free devices, making our public transportation system safer. However, that being said, I feel that Section 5, which would require people after their 75th birthday to go to the Registry of Motor Vehicles in person to renew their driver's license and to have a vision test, which, by the way, when you go now, today, when I went last October to renew my license, I had to have a vision test. So that's nothing that's new. We're just codifying that. I feel that this doesn't belong in this bill, and furthermore, that 75 is an arbitrary age. Who's to say that we should do this at 75? Maybe it should be 80, maybe it should be 50. You know, some people say that 75 is the new 55. So who's to say that's the right age? I'm further concerned that this will create a public safety hazard as an unforeseen consequence. For example, in my district, the distance from my hometown of Provincetown to the registry, the nearest registry of motor vehicles, after we've experienced the recent closures, is 44.1 miles. 44 miles from Provincetown to the registry. It's some 34 miles from Wellfleet. It's well over 30 miles from Chatham to get there. So what we are doing is asking our senior citizens to get in their cars, drive often in heavy traffic. You know, Lord help you if your birthday falls between the 1st and 10th of July and you live on Cape Cod and you're 75 and you suddenly have to go to the registry and you can't renew your license online. I think that that in and of itself will create a public safety hazard. And furthermore, and perhaps what's most important here, is we have fully addressed the issue around driver safety with Section 7 of this bill. What Section 7 does in shielding our healthcare providers from liability for either reporting or not reporting conditions in their patients that might lead them to believe the person is too impaired to be able to operate a motor vehicle. What we have done is we have created an avenue for people who truly have a problem and people who should be off the road and not have a driver's license for that information to get to the Registry of Motor Vehicles. And you know what? There are people who are 20, there are people who are 40, there are people who are 60, there are people who are 80 and older who are all very good drivers. And there are also people in those age ranges from 20 to 40 to 60 to 80 that due to either a physical or mental impairment should not have a driver's license and should have to be tested to show that they are able to drive. So while I applaud the overall bill, I feel that Section 5 respectfully is misguided. It is unfairly targeting one segment of the population. It may have unforeseen consequences which will create a more dangerous situation, and Section 7 does what we need to do in order to identify and appropriately handle those drivers who should not be drivers any longer. Thank you, and I hope the amendment passes. Thank you, Mr. Speaker.